It's a crime as old as crime itself: fraud. And while techniques have evolved over time, the practice remains rooted in trickery, deception, and theft. Much of today's fraud is hidden behind the veil of the internet and represents one of the fastest growing segments of criminal activity. Those who commit fraud are well-funded, hard to catch, and skilled at exploiting vulnerabilities. Government and social agencies have been especially prone to fraud in recent years as offenders hone in on improper payments, waste, and abuse across a multitude of programs. Internal fraud is a primary concern, as it often has a direct impact on the public sector, especially as it relates to identity theft. IBM Counter-Fraud Management is exceptionally well-suited to assist government and social agencies in performing innovative investigative work using multi-layer advanced analytics. It provides big-picture visibility into an entire threatscape, offering an integrated approach to identify false positives and prevent vulnerabilities. The program monitors an organization's disparate data and applies multiple layers of analytics to correlate insights across various channels. It also provides analysts and investigators with a comprehensive real-time view of their risks, using everything from predictive and geospatial analytics, text mining, and transaction velocity, to social network analysis, automated profile generation, and peer group clustering. By correlating insights from multiple channels, investigators and analysts can more accurately identify, evaluate, and mitigate fraud, waste, and abuse, many of which may have otherwise passed through the system unnoticed. Take, for example, the case of a Florida company that generated thousands of fraudulent prescriptions for unneeded and expensive pain medications. The supposed patients were actually low-income beneficiaries of government-funded healthcare programs and did not require the prescribed medication. Instead, these patients filled prescriptions and delivered the drugs back to the company for a nominal payment. The drugs were then diverted into the black market, sold to other pharmacies, and were rebilled to the healthcare programs as though they were being dispensed for the first time. The IBM Counter-Fraud Management Program is built to uncover this type of fraudulent activity. It can identify instances where the company was prescribing pain medications to multiple patients on government healthcare plans, as well as instances where a patient's diagnosis code would not typically call for pain medication, but narcotics were prescribed anyway. The company, in fact, was billing almost triple the typical amount of daily patient visits. And many of the beneficiaries included veterans recruited from dual diagnosis programs for drug addiction and schizophrenia, elderly Medicare beneficiaries whose identities were stolen, and homeless beneficiaries. The program also helps qualify new providers against exclusion lists, as well as criminal and death records previously known for suspicious activity. Using IBM Counter-Fraud Management, the evidence would overwhelmingly point to government-funded health insurance fraud and conspiracy to commit identity theft. It's detective work at its finest, keeping government and social agencies and the people they serve a step ahead of fraud. Find out how IBM Counter-Fraud Management can be your first and last line of defense.